Hello everyone. My name is Christian Name and I'm one of the geriatric fellows at the University of Illinois in Chicago. I will be presenting Journal Club today about a research article called Sensitivity and Specificity of the Bamberg Dementia Screening Test's Full and Short Versions, brief screening instruments for geriatric patients that are suitable for infectious environments. I'm going to quickly summarize the paper, then briefly talk about important things to look at when critiquing a paper about diagnosis. Currently, there are many patients suffering from dementia who do not have a diagnosis when admitted to geriatric hospitals. This is the case despite an increased risk of complications affecting the length of stay and outcome. Unfortunately, many dementia screening tests cannot be used on geriatric inpatients, who are often bedridden and cannot perform many parts of the test. In this study, they used the Bamberg Dementia Screening Test, which was administered to a number of patients. This test, there is like a short version of this test, an ultra short version of this test, and the full version, which takes around 7 minutes to administer. The full version looks into many cognitive domains, including semantic memory, verbal memory, visual construction, verbal fluency, visual memory, and cognitive flexibility. This test was administered to a consecutive series of 1,295 patients referred for neuropsychological testing. The diagnosis of dementia was confirmed in 1,159 and excluded in 136. Afterwards, the sensitivity and specificity was calculated for the different versions of the test, and the receiver-operator characteristic curves were obtained. These numbers were also compared to the mini-mental status exam. The overall diagnostic quality of the Bamberg Dementia Screening Test was superior to the mini-mental status exam for mild Alzheimer's dementia, as well as for other subtypes of mild dementia. Even the short form of the Bamberg Dementia Screening Test was comparable to the mini-mental status exam regarding sensitivity and specificity. So in conclusion, this test is able to detect dementia in geriatric hospital settings, and it does not take a lot of time to administer.